Hello everyone, welcome to my channel. Today we are discussing kidney disease. Statistics show that 1 in 7 adults has kidney disease, and out of those that have kidney disease, 9 out of 10 don't even know they have it. Those numbers are terrifying to me. That means millions of people are suffering from kidney disease and don't even know it. When most of these symptoms show up, that means your kidneys are already damaged. So this video is a cry of warning and a cry of action to not ignore these symptoms. This is coming from somebody who did ignore these signs. In just over a year, I went from learning I had kidney disease to being on dialysis, and this was not an easy journey, and it completely changed my life. So if I can help somebody else be able to delay or stop kidney disease, I feel like all this suffering had a purpose. The first one is hypertension, that means high blood pressure. The heart and the kidneys both work together to move and to clean your blood, so they're very connected. High blood pressure will cause kidney disease, and kidney disease will cause high blood pressure. The second is those that have diabetes. Now all that glucose going through your blood affects your kidneys and will damage them. And also having diabetes often will cause hypertension, high blood pressure. So these are all so interconnected. The kidneys have these filters and the blood going through them are absolutely tiny, so any raise in blood pressure or this extra glucose going through will damage them because they're so sensitive and so little. The last one is those that haven't been eating a healthy diet, for those that do not exercise enough and are overweight. Being overweight often causes diabetes and hypertension. So if you have one of these, make sure that you're getting your kidneys checked. The first symptom that I want to talk about is that your change in urine. Now that could mean you're using the bathroom or you're going to the bathroom less, but it could also be changed in the volume. So maybe you're going to the restroom more, but there's less urine is produced. It can also mean a change in color. It could also mean that when you use the restroom, it's foamy. Now people ask, what does that mean? What does that look like? So when you pour soda or pour a beer, there's that foam around the top, and that'll be similar to what foamy urine looks like. Now the reason for the foam is that you're leaking protein, so these bubbles or foam when you use the restroom, they don't pop, they don't dissipate, they just sit there. Of course, you can see why these are easy to write off and not pay attention to because you're like, oh well, I have to get up in the middle of the night because I drunk more or I'm just getting old, or the change in color. Yeah, that's easy to write off and blame on our diet. But if something has changed and it's become the new norm, that is a warning sign that something might be happening. So pay attention to your pee. The second sign I want to talk about is easily fatigued. This could be physically or mentally. So something that you're able to do has now become a little more difficult or you're a little more tired from it. Could be a sign of kidney disease. And maybe your ability to focus, to really be able to pay attention for long periods of time. You're finding yourself distracted or just not as mentally sharp as you were before. Again, can be a sign of kidney disease. This is easy to write off because you're like, I'm getting older. I've gained some weight. I didn't eat healthy yesterday or I haven't been getting enough sleep. And that's the reason why. But again, if something has changed and it's become the new norm, figure out why. The third sign I want to talk about is edema. That means you have extra fluid on your body because your kidneys aren't able to draw that from your blood and get rid of it. So the first places that you'll notice that you've got extra fluid is usually around your ankles and feet, on your fingers, and then also on your eyes. So your eyelids will be puffy, they'll look like they're thicker than usual. And for me around my ankle, I had it more on my right ankle than my left, and it was just below my ankle bone, it was just a little. I'd push on it, and it would just be a little bit of extra fluid. Now this is easy to ignore because again I'm like, oh, I had too much salt, and especially around the eyes. I'm just not sleeping well, and not sleeping well is also another sign of kidney disease. So how do you know if you have extra fluid on your body? This will really show up when you're holding a lot of extra fluid. So you can take your thumb and you can push on that spot that you feel like you have extra fluid, and you push down hard and you let it hold there for a little bit, and then when you lift up your thumb, if that is still imprinted on your skin, you still have that little dip, then you're definitely holding on to too much fluid. The fourth early sign of kidney disease is change in your skin. Usually it starts to feel kind of dry and itchy and maybe a little bit scaly. It can also mean like you're getting a little bit more pale or gray or your skin is yellowing. For me, I got pale and my skin started to turn really yellow. But before that, my skin was dry. Now I am sensitive to dry skin, so this was easy for me to just ignore and not take care of or not think it was a big issue. Instead, I just started to get nicer lotion and put on more lotion. And also my scalp started to itch. So this itching doesn't necessarily mean all over your body. It could be a single area or a single spot. For me, it was more in my scalp, and so I noticed it at night when I'd lay down to sleep. It'd just be itchy. So I just thought, oh, I better change my shampoo, and I better use a better conditioner. So this is also easy to ignore. The fifth sign is having a metallic taste in your mouth, or a bad taste in your mouth, and having bad breath. You can see why this one's easy to ignore because we'll just be like, oh, I didn't drink enough, or it must be that garlic that I had in yesterday. I found with this is because of this bad taste in your mouth. For some reason, food doesn't have as much flavor as it did before, and you'll try to add salt or try to add sugar to your food to make it brighter, but for some reason, it just kind of dulls everything. The sixth sign is weight loss, and you can see how it's hard to pick up if you have kidney disease because one of the other signs of kidney disease is weight gain because of the fluid. But this weight loss is unexplained, and often you will start to feel kind of nauseous just in the morning, and that will go away, and also food just doesn't seem as interesting to you. I've heard that some people actually are not wanting to eat meat, it just doesn't sound good, it doesn't feel good. So you can see again why it's easy to kind of write this off. Oh well, I haven't been eating as much, so obviously I would lose some weight. Now the first one is the easiest one, that's taking your blood pressure. If your blood pressure is raised and you have hypertension, you definitely want to check on your kidneys. The second one is a test that you can do to see if you are losing protein in your urine. The third test you can do is called Comprehensive Metabolic Panel, I think CMP, and what that will do will check your levels of glucose, your sodium, your potassium, your calcium, and your creatinine. So that one is very helpful to figure out how well your kidneys are functioning. The fourth test that you can do is called a Complete Blood Count CBC, and it will check your red and your white blood cell count because often when your kidneys aren't working as well, you will find that your iron is low, which means your hemoglobin is low, which is your red blood cells, and that can kind of clue you into something is not right. I did look up Quest Diagnostics. They do lots of lab work with blood and urine, and I think they're throughout the United States and I think in a few other countries. So they have a test called the Kidney Function Test. This is about $100, and they'll take a blood sample and a urine sample to get a good idea of how well your kidneys are functioning. The other test I looked up was the Complete Metabolic Panel, and that test will be around $45. Now I also mentioned the Complete Blood Count Test, and that test costs about $35. If you're worried about your urine, it looks kind of foamy, you can do a test yourself. I looked off of Amazon, and you can get a bottle full of strips, about 100 strips for about $10. And that will check if there's protein, any kind of protein in your urine. Please be proactive over your health. You know your body the best. I hope you're enjoying this channel so far. And I hope you subscribed already if you didn't do it. And if you did, watch this video right there. I think that will help you too.